Hi everyone, my name is Maria. I'm a psychology student and researcher in University of Fortaleza in Brazil, and it's a pleasure to be here today. I would like to thank the organizers for giving me the opportunity to share our study, Social Determinants of Mental Health in Diabetes, Intersectionality, and the Sustainable Development Goals. First, I would like to briefly introduce what is diabetes. Diabetes is a chronic disease in which the body has inappropriate production or use of insulin, leading to high blood sugar levels, known as hyperglycemia. One of the main consequences of hyperglycemia is organ damage or system damage. It's important to note that there are three types of diabetes. Type 1, which is an autoimmune disease. Type 2 is when the body is not able to produce enough insulin to control the glucose on the blood. And gestational diabetes that happen during pregnancy and is related to the difficulty of the body to use the insulin that it produces. When we talk about numbers, the prevalence in a global population is 11.1%, and in Brazil, 10.6% of the population has the diagnosis of diabetes. Now that we understood what is diabetes, it's important to understand the role of the social determinants of health in this context. There is a wide range of studies that talks about the bidirectional relationship between mental health and diabetes and how pre-existing mental health problems can impact on the diabetes treatment and how the management of the disease can impact the mental health of patients and cause mental health burden. After the pandemic, this relationship became even more evident and increased the impact of the social determinants of health and also factors in intersectionality. When we talk about social determinants of health, we talk about the social, economic, and environmental factors in which the people, the person, our patients were, it was their context. And when we talk about intersectionality, we talk about the overlapping of social markers that can impact the patient's lives and create a very unique profile of vulnerability that can impact their experience with the disease. Now that we understood this, the main objective of our study was to examine the predictive capacity of social variables on mental health indicators in people with diabetes in the post pandemic context. To achieve this main objective, we perform a quantitative, descriptive, cross-sectional, analytical, and national study with 462 Brazilians, and we use five different instruments: a social demographic questionnaire and four different scales. The first scale investigates the symptoms of anxiety, is GAT-7. The PHD-9 investigates the symptoms of depression. The WHO-5 is related to well-being, and BASE-6 is related to stress. To analyze our data, we use a software called SPSS version 27, and we perform three different analyses: a descriptive analysis, biserial correlations, and a multiple linear regression. Moving on to our results, I would like to briefly highlight some important social demographic characteristics of our sample. Our sample was mostly composed by female, white, that were married, had a low income, that had COVID, and that had gone through psychological and psychiatric treatment. And most of our patients had a long-standing diagnosis. The second analysis that we did was a correlation analysis. These analyses help us understand the association between each social factor and each mental health outcome. So, when we correlate anxiety, depression, and stress with the social factors that we had, we found out that we found positive correlations with female, psychological and psychiatric treatment, and having a partner. This means that anxiety, depression, and stress scores were higher in female that had gone through psychological and psychiatric treatment and had a partner at the time. And we found negative correlations with education, income, and health insurance. That means that the higher the education, the higher the income, and the higher and people that had private health insurance, they usually had less problems with anxiety, depression, and stress. When we talk about well-being that is measured by the WHO-5, it's important to remember that the WHO-5 is a scale that works in the opposite way. So the higher the score, the higher the well-being. So people with higher education, higher income, and they had a private insurance, they had a better well-being. While people with a long living with the diagnosis for a long time and that had gone through psychological and psychiatric treatment, they had a lower rate of well-being. Now that we understood the associations, we have to deepen our understanding and try to understand which variables predicts these mental health outcomes. To understand which variables predicts, we perform a multiple linear regression. We found, and in related to anxiety, that having a lower education, having have gone through psychiatric treatment, having a lower income, and having a partner explain 8.9% of the variance. And when we talk about depression, have gone through psychiatric treatment, not having a private health insurance, and having a lower income explain 12.5% of the variance. Stress, have gone through psychiatric treatment, having a lower income, and having a partner at the time explain 8.7% of the variance. And finally, well being. When we talk about well-being, like I said, is a reverse scale. So people that had not gone through psychiatric treatment, that had a private insurance, and that had a higher income had a better well-being. So here's a summary of our key findings. With our results, we could understand that our sample had relevant levels of psychological burden and reduced well-being. We could also find some repetitive predictors like psychiatric treatment, income, health insurance, partner status, and education. And this helped us shape a more specific profile. And this profile was composed mostly by women that had low education and income, that had no private insurance, that had a longer diagnosis time, and a history of psychological and psychiatric treatment. All of this led us to understand that the psychological burden is not explained only by clinical and biomedical variables alone, but is strongly associated with social factors. Now that we understood this profile, that we talk about this specific profile, how can we actually understand where this profile came from? And the answer is intersectionality. Rather than just adding up, the social factors they interact and they reinforce each other, creating very specific profiles and different levels of vulnerability. And when I talk about intersectionality, we're talking about gender, race, class, education. And when we understand this, we can understand that the diabetes care cannot only be based on clinical indicators and treatment, but you also have to understand that the social factors are important, especially because we have different experience and different profiles when we talk about this disease. So our study also aligns with two main social development goals, the third and the 10th social development. The third social development is about health and well-being and is a call for a more integrated physical and mental health care. While the social development 10th is about reducing inequalities and about the need for more equitable access regardless of income, insurance, or education. Ultimately, our study reinforced the 2030 Agenda commitment to leave no one behind. To conclude, I would like to highlight some of the main findings of this research. We could understand that mental health is shaped by social determinants and it goes beyond a biological model. And these show us that there is a need for more public policies that can integrate clinical care and also psychological support. Although our study could comprehend all of this, we had some limitations, our cross-sectional design and non-probabilistic sample, but it provides a very important evidence that support the 2030 agenda and the social development goals. For future directions, we could understand that making a longitudinal study and also adding more social determinants like territory and food security could increase the findings and get better and find more things about this topic. These are my references, and thank you very much. If you have any questions, I'm here to answer.